ethical challenges and assess barriers in the context of SDGs 3, 5, and 9.
Greetings, panel chairman. I believe I'm audible. Am I audible?
Yes, you are. You are.
Okay, thank you. Greetings, panel chairman, senior colleagues and friends. Permit me to stand on the existing protocol. I'm Clement, a DBA candidate in healthcare management, Rochefort Business School, Switzerland. I bring greetings from the beautiful city of Lagos, Nigeria. My paper presentation is titled Integrating Telehealth into Women's Health Management, Ethical Challenges and Access Barriers in the Context of SDG 3, 5, and 9. By way of introduction, we stand at a pivotal moment in healthcare, witnessing a revolution, not just in medicine, but in its very delivery. At the heart of this change is telehealth, a transformative innovation with the power to reshape access to care, especially for women who have long faced systemic health disparities. The promise of telehealth extends far beyond mere convenience. It potentially aligns powerfully with the global ambitions at the Sustainable Development Goals. It's a direct contributor to SDG 3, promoting health and well-being. It advances SDG 5 on gender equality, and it fosters SDG 9, building resilient infrastructure and promoting innovation. As we saw during the COVID-19 pandemic, this is not just theoretical. The crisis catalyzed its global adoption, providing telehealth vital role in ensuring care continuity when health systems are under siege. But, and this is a critical but, the immense promise is shadowed by significant challenges. We cannot let our optimism blind us to the very real ethical and access barriers that threatens to exclude the very people we aim to help. Let's first consider the ethical landscape. When care moves to a screen, new risks emerge. We face critical concerns over the privacy and confidentiality of sensitive information. We must navigate the challenges of securing genuine informed consent remotely. And we see threats to women's autonomy, particularly in sensitive areas like reproductive health, while decision-making can be compromised without a safe space of a clinical room. Simultaneously, the bridge to equitable access is crumbling under the weight of pervasive digital divide. This isn't just about having smartphone, it's about inadequate infrastructure, the barrier of cost, and low digital literacy, and it's compounded by deep-seated social cultural norms and patriarchal structures that actively controls women's access to and use of technology. A tool meant for liberation can, in this context, become another site of control. Therefore, we must be clear. Realizing the full potential of telehealth requires more than just deploying new technology. It demands a justice-centered approach. Research question. Our research is guided by three central questions. First, what are the primary ethical challenges involved in telehealth integration of women's health? Second, what access barriers limit equitable telehealth service utilization by women across different contexts? And third, what research policy gaps exist and how can they be addressed in support Sustainable Development Goals or SDG targets? To thoroughly investigate these complex questions, our study employs a multi-theoretical framework. We began by utilizing a digital health equity lens to examine fair access and outcomes across social digital divides. This is combined with the principles of feminist bioethics, which provides a critical focus on power relations, autonomy, and intersectionality in healthcare delivery. Furthermore, our analysis is grounded in SDG-aligned policy framework that prioritizes justice and inclusion. By integrating these three powerful perspectives, our research investigates how telehealth can both serve and marginalize different groups of women. We seek to understand how outcomes are shaped not by individual choice alone, but by structural factors like digital literacy, socioeconomic status, and data governance. It is not only by confronting these challenges directly that we can ensure the promise of digital health becomes an equitable reality for all women. Literature review. Today, we stand at an intersection of technology and humanity, examining a tool with the power to reshape women's health globally, telehealth. A systematic review of 23 studies paints a picture of both profound promise and significant peril. The potential of telehealth is aligned with core global ambitions, the Sustainable Development Goals for health, for gender equality, and for innovation. It promises transformative benefits, no doubt, overcoming vast geographical barriers, no doubt, to provide timely reproductive, chronic, and preventive care. Yet, as do Nascimento and colleagues highlight in their 2025 review, the implementation of this promise is fraught with significant challenges. The path forward is obstructed by persistent ethical concerns in a field often characterized by weak regulation. The risk to privacy, data security, and informed consent are prominent and alarming, as noted by Solimini et al. In 2021 and Langaridel et al. Back in 2017. Furthermore, we are confronted by a deep digital divide that threatens to turn innovation into a new source of inequality. Women in low-income and rural and underserved communities faced overwhelming barriers. As Lestari and our team emphasized in 2024, these include digital illiteracy, poor internet infrastructure, and restrictive social, cultural, and economic norms. This inequality is compounded by fragmented policy environment that lacks the coherent gender-responsive governance necessary for success, a point critically identified by Abdel Wahab and colleagues in 2020. So where does this leave us? When we analyze this landscape through the critical lenses of digital health equity, feminist bioethics, and SDG-aligned evaluation, the literature sends a clear, unifying message. Technology alone is insufficient. To bridge the gap between potential and practice, we must be deliberate. To ensure a just and sustainable integration, telehealth initiatives cannot be neutral. They must be explicit, designed to dismantle the structural and ethical barriers. As Lau and colleagues argued in 2023, we must leverage the Sustainable Development Goal framework not as a mere checklist, but as a blueprint. It's our guide to build equitable, inclusive, and truly progressive health system for women worldwide. Methodology. Let me now walk you through the rigorous methodology that underpins our findings. Our investigation took the form of a systemic literature review, meticulously conducted in accordance with PRISMA guidelines. The primary objective was to critically examine the integration of telehealth into women's health with a specific lens on ethical challenges, access barriers, and its alignment with the 3 Sustainable Development Goals, SDG 3 for good health and well-being, SDG 5 for gender equality, SDG 9 for industry innovation and infrastructure. To ensure a comprehensive capture of the existing literature, our search strategy spanned 5 major academic databases: PubMed, Scopus, Web of Science, CINAHL, and Google Scholar. We employed a targeted set of words to guide this search, including phrases such as telehealth and women's health, digital divide and gender, telemedicine and SDGs, ethics of telehealth, barriers to telehealth, and feminist digital health. We established clear inclusion and exclusion criteria to maintain focus and relevance. Our review significantly incorporated peer-reviewed open access articles published in English between 2015 and 2025. To be included, studies had to be examined telehealth interventions, policies, and access issues in women's health, and make a clear reference to all at least one of our focused SDGs, 3, 5, and 9. Furthermore, the literature was required to address ethical legal challenges or access disparities. The screening process was rigorous. From an initial pool of 40 identified articles, we first removed 9 duplicates. The remaining 31 records were then screened by their title and abstract. Following this, we retrieved the full text report for a detailed eligibility assessment. This process culminated in a final set of 23 articles that were included by the final synthesis. The data extracted from these 23 studies were then subjected to a thematic analysis. This allowed us to cluster the findings around the key areas that form the core of our presentation today, namely ethical concerns, manifestation of digital divide, the linkage to equity and SDGs, and finally, the resulting policy recommendations. We stand at the digital crossroad in women's healthcare. Telehealth promises a future of convenience and expanded access, but we are here today to sound a note of caution. because if we are not deliberate, this powerful tool risks leaving the most vulnerable women behind, turning a promise of access into a new source of disparity. Let's first consider the ethical minefield we must navigate. The very sensitivity of women's healthcare, from reproductive services to care of survivors of intimate partner violence, makes data privacy a paramount concern. A security breach here isn't just a leak of information, it can deter a woman from seeking life-saving help. Furthermore, the process of informed consent is often rushed and inadequate in virtual settings, failing to account for differences in literacy and comprehension. We must also confront the threat to women's autonomy. Gendered power dynamics within households can mean a woman's lack of privacy or agency to even use these services. And when things go wrong, a fragmented regulatory landscape offers little accountability, leaving vulnerable users exposed. Finally, we face the risk of encoded bias. AI-driven tools, if not carefully designed, threaten to perpetuate and even amplify the very inequalities in our current systems. But the challenges are not just ethical. They are profoundly practical. For many women, the digital door is simply locked. Structural barriers like limited broadband, high cost of data, and simple device unavailability disproportionately affect rural low income and older women. And for others, even with a device in hand, a significant digital literacy gap prevents them from using these services effectively. Beyond infrastructure and skills, we face deep-seated socio-cultural walls. The surveillance of women's device usage by family members and their persistent stigma surrounding sexual and mental health can make a private, autonomous telehealth consultation an impossible dream. So is the answer to abandon telehealth? Absolutely not. The answer is to build it better. Research is clear. We must move beyond a purely technical fix. We need a transformative telehealth model built on three pillars: digital equity, feminist ethics, and strong accountability. This means co-designing with marginalized women, not just designing for them. We must use participatory design to ensure services meet their real-world needs, conducting regular gender and equity audits to proactively identify and correct biases and gaps, investing not just in infrastructure, but in digital literacy, empowering women to know how to use technology, Android phone, iOS, and confidently. Merely expanding internet access is not enough. We must tackle the foundational social and gender-based inequalities that are the true root of this digital divide. Current implementation often favor aggregate reach over meaningful intersectional impact. They fail because they lack the necessary monitoring and community-driven adaptation for true equity. Recommendations. Friends, colleagues, advocate, telehealth holds incredible promise. It can revolutionize how women access care, breaking down barriers of distance and time. But for this promise to be fulfilled for all women, we must be intentional. We must build a future that is not just digital, but equitable. So how do we get there? The path is clear and it requires our collective actions on four key fronts. First, we must build a foundation of trust and safety. Second, we must bridge the digital divide, not just with wires, but with wisdom. Third, we must design with women, not just for them. And fourth, we must ensure our technology is inclusive by design. The call to action is clear. By working together on this front, building trust, bridging divides, designing with women, and insisting on inclusive technology, we can move beyond potential. We can forge a new reality, a truly equitable and inclusive digital health future for every woman everywhere.
Okay, I have a question for you. Yeah. I'd like to ask you about, yeah, you highlighted in your presentation that restrictive social control norms can prevent women's autonomous use of telehealth. So in your view, which is more effective at overcoming this? The designing more fit and secure technology, or implementing community-level education program to challenge this norm?
I think they are all very important, especially considering what the problem telehealth intends to solve, which is to be able to provide quality access to all women, irrespective of where they live, especially women in the rural areas. Now, we can look at only providing, and in most of these rural areas, especially here in Africa, in Nigeria, where I live, in the rural area, there's very limited access to the internet. Now, most of the telehealth platforms are designed with need for data availability. And where these women live in the rural areas, there is difficulty in being able to access internet or data. Therefore, that is one, which, of course, there could be better expansion of coverage of internet to these areas. But you also need to keep in mind the next challenge, which is the ability of these women in these rural areas to be able to engage that technology. All right. So that is another challenge, which is the knowledge, the technological literacy for these women on how to operate this technology.
So thank you for your conclusion, and as well as for your response. And I totally agree with your call for justice-centered approach, moving beyond more technological deployment to address the digital divide and social counter barrier is a crucial point for all policymakers.